If you are getting ready to turn 65 and you don't want Medicare, hopefully because you have what we call credible coverage. You have coverage through your employer or your spouse's employer that's as good or better than Medicare. And typically if your plan has 20 or more people, that's the threshold we're looking for. 20 or more employees, you don't need Medicare. You might want Medicare. It might be better than your insurance at work. Do a comparison. But if you've already done the comparison and you're like, yeah, I'm just going to stay on my husband's plan. What do I have to do now to notify the government that I don't want Medicare? As long as you're not taking Social Security at least 4 months before you turn 65, you don't have to do anything. You don't have to fill out a form, talk to somebody, play back and forth with Medicare or Social Security. You do nothing. I like that. That's beautiful. But that makes people nervous. They're like, no, I need them to know. No, you don't have to do anything. As long as you have credible coverage, meaning your work insurance or your spouse's plan has 20 or more employees, you don't have to do anything. But you're like, I don't want to get this late penalty. I've heard about this penalty. That is true. When you do decide to retire and you want Medicare, and maybe that's in 2 months, maybe that's in 2 years, 12 years, whatever it is, you're preserving your rights from when you were 65. We're extending it down here to whenever you do retire. So say you retire at 75, okay? You are going to be treated by Medicare, by the insurance companies, as if you were 65, as if you were just going into Medicare at the first time, even though it's been 10 years. Because you had credible coverage all this time, uninterrupted, hopefully, there is no late penalty. Now, how do you prove that? You will fill out the form CMS, Centers for Medicaid Services, CMS-564, the L564. And that is a form that basically your employer fills out. Your employer says, yeah, Sylvia has been working here for the last 10 years, and then you don't have a penalty. Now, the problem can occur is if in those 10 years you had one employer and then they went out of business and then you got another employer, you're going to have both of them sign to prove for that full 10-year period that you had coverage, hence no penalty. And if that guy went out of business, that can be a problem. It's rare, but most people are going to have one employer that will fill out the form, the CMS L564. It's very simple. You can drop it off at the Social Security office. You can upload it. You can fax it to them so that you do not have a penalty. And then at whatever age, so in this scenario, say you're 75, you can get any insurance plan regardless of your health, which is a big plus at 75 because you might have some health conditions by then, as if you were 65. Because when you're 65, they can't ask you any health questions. You can get any insurance plan. So now you've just delayed that for 10 years. And now you have those same rights. No penalties, big financial benefit. And no, they're not dinging you because you might be sick. You can still do everything a 65-year-old could do. So continue to work as long as you want to work. People are working longer, you know. People are living longer. They're healthy. A lot of people like their jobs and want to work. Don't be nervous. Now, one of the things that people do is they're not really sure about this. They've heard about the penalty. So their whole concept is be safe than sorry. So they heard they don't need to sign up for Medicare. They don't have to pay almost $200 a month for Medicare Part B. They heard that, but they're not quite sure if that's accurate. So just to be safe, rather than sorry, they're going to sign up for Medicare Part B and pay that monthly anyway. You can do that. I only recommend that to somebody to have work insurance and Medicare if you're really sick. If you're going to undergo cancer, it could benefit you. But for most people, this Medicare you're paying for is not really going to benefit you. It's just wasted money. So for most people, I would say choose either Medicare at 65 or your work insurance, but you're not really going to want both. You're wasting money. But a lot of people want to be safe and sorry because they're not watching my videos. You are watching, you are learning. So if you learn something, please share it with your friends. I guarantee you they don't know this.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.